Hello and welcome to the September 12, 2006 podcast for the American Institute for Cognitive Therapy at cognitivetherapinyc.com. The American Institute for Cognitive Therapy is an internationally known group of cognitive therapists under the direction of Dr. Robert L. Leahy. Today we're going to be discussing cognitive therapy for the treatment of obsessive-compulsive disorder. I'm Dr. Dennis Tirch. All of us have thoughts and daydreams that seem strange to us. Images of violent or bad behavior might seem to pop into our heads, or we may begin to wonder if we're susceptible to germs or contamination. Most of the time, we don't pay these random mental events much mind. We simply shrug them off and get on with our day. Sometimes, though, these images can persist. Like a pop song that gets stuck in our heads, these disturbing ideas keep coming back again and again. It can seem that the more we try to force such inappropriate, unpleasant, or even seemingly sinful ideas out of our consciousness, they only return with greater force. Intrusive thoughts that persist in this way may be symptoms of obsessive-compulsive disorder, which is sometimes referred to as OCD. As if these thoughts weren't distressing enough, the prospect of suffering from OCD can seem even more alarming. Media images of people with OCD, such as Jack Nicholson's character from As Good as It Gets, or the TV detective Monk, often depict people with overwhelming psychological problems. Of course, some people with OCD do face significant challenges, but OCD doesn't have to be a life sentence. Fortunately, cognitive therapy has developed a focused and short-term approach to the treatment of OCD that has proven effective in numerous clinical trials. Whether you live with a psychiatric diagnosis of OCD or simply struggle with troublingly persistent intrusive thoughts, cognitive therapy can offer a way to potentially master these mental events and to effectively cope with the anxiety involved in dealing with them. Through cognitive therapy, a patient can learn to demystify the process of obsessive thinking. A qualified cognitive therapist can help a patient break the cycle of stigma and shame that leads them to label these thoughts as crazy, bizarre, or even blasphemous. Patients learn how the simplest dynamics of human learning lead some of us to develop distressing thoughts that persist in befuddling ways. In the first few weeks of cognitive therapy, most patients come to realize that all of their efforts to suppress their thoughts have only come to make the problem worse. Such patients come to learn that their overinterpretation of the harmfulness of their thoughts can lead them to futile attempts at thought control, which only further propels a cycle of obsessional thinking. Gradually, one can learn that these thoughts in themselves aren't harmful or crazy. Working in a respectful and collaborative way, a cognitive therapist and patient can come to approach these thoughts rather than try to suppress them. Cognitive and behavioral therapists use a method known as gradual exposure to guide a patient to confront the things that they fear in a controlled and safe fashion. Using exposure, people with OCD come to accept and face the disturbing thoughts and images rather than suppress them. In doing so, the nagging persistence of the thoughts may decrease, and they may become far less threatening. Exposure, though, is just one of the tools in the cognitive therapist toolbox, and patients and cognitive therapists work together to define and implement specific solutions for individual challenges. Now, some stereotypically old-fashioned therapists might suggest that OCD is the result of childhood problems, past emotional conflicts, or deep-seated issues. Cognitive therapists, however, take a different approach, which doesn't suggest that people with OCD are psychologically damaged or suffering from the aftermath of bad parenting. This present-focused approach provides useful, evidence-based methods for the management and mastery of obsessional thinking. As a result, living with our intrusive thoughts cultivating resiliency towards anxiety, and engaging in a life well lived become the aims of the therapy, rather than living in fear that we might be crazy because of the inevitable but uninvited visits from our intrusive thoughts.